Rita, how's it going?
Okay, I guess. I'll know more once my Aunt Hazel Barnes and I meet with you tomorrow.
She's your aunt?
Yes, and we're worried about what you're gonna say.
Well, I'm glad you'll be there.
Okay, see you tomorrow. Hazel? 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 Where are you? Okay. How's it going?
I thought I'd pop into town, get my colonoscopy, and go home. But I guess it's not going to be that simple. I should have listened to you, Bev and Isaac, about getting my colon exam a couple years back. All that early detection is the best protection stuff. I don't know why a colon exam is so different than all the other exams we have to do to take care of ourselves.
Yeah. I remember getting my first pap smear. Wasn't something I looked forward to. You and Mom are so supportive. You'll go get your pap smear so you don't get cervical cancer.
Remember how awkward it was when your mom and I were trying to explain having a pap smear?
It's good we could talk about these things. Health stuff that really matters. Well, I'm glad you came in and got your colon exam.
It may be too late. I should have gotten my colon exam when I had my last mammogram. What do you think he's going to tell us?
I don't know. He said he removed 2 polyps.
Polyps?
It's a growth in your colon. Small polyps can be removed during the colonoscopy procedure. He did that, and that's a good thing. Some polyps can become cancer. By finding and removing polyps early, we can prevent colon cancer.
But there was another polyp?
Yes, he found an area of concern. He found a larger polyp that he couldn't remove, so he took a biopsy.
Biopsy?
A biopsy is the removal of a small piece of tissue that's sent to the lab. A specialized doctor called a pathologist looks at the cells under a microscope to see if they are normal looking or if they're cancerous.
Polyps and biopsies. Jeez. Getting a colon exam on time sure beats sitting here worrying about what I may hear tomorrow.
Let's get something to eat, then hit the sack. We'll know a lot more tomorrow. Yes?
Hi, Rita. Hazel, good to see you again. How are you doing?
It's been the longest few days of my life, waiting to find out what you have to tell me.
During your colonoscopy, we found 3 polyps. 2 of them were quite small, and I removed those. The lab report shows that those 2 smaller polyps were benign. That means they were not cancer. But here, I found a 3rd larger polyp I was unable to remove. I biopsied it, and it has cancer cells.
I have cancer.
Yes, in part of your colon. But there's some good news. I reviewed your CAT scan and your other test results, and it looks like we found your cancer early before it's had time to metastasize or spread to other parts of your body. We call that stage 1 cancer. Most stage 1 colon cancers are treated with just surgery.
Just surgery?
Yes.
You mean she may not need chemotherapy or radiation?
But I won't know for sure until after surgery.
Why not?
During your surgery, I'll remove the cancer from your colon and a little extra tissue on either side to make sure we get all the cancer. And I'll remove several lymph nodes. These are small glands near the colon to be sure the cancer hasn't spread. All the tissue I remove we'll send to the pathologist. After your surgery, when we get the pathology report back from the lab, your cancer will be discussed at tumor board.
What's that?
The hospital has a treatment planning process we call the tumor board. All the people involved in cancer care meet once a week to discuss the best treatment plan for you and other patients diagnosed with cancer.
It's like getting a lot of second opinions. Dr. Newman is there, and other experts, oncologists, the pathologists, social workers.
After the tumor board meets, we'll discuss whether chemotherapy or radiation, or quite possibly neither one, is recommended. But now, we need to schedule your surgery.
I don't want to get all cut up.
I'll make the smallest incision I can and still get all the cancer.
There goes my chance at being a bikini model. Will I be in pain after surgery?
Immediately after your surgery, we'll give you some medication to keep you comfortable. But you won't need all that much, and not for very long. You'll be out of the hospital in a few days.
Auntie, this isn't going to be nearly as hard as you think it is. A couple of days at the hospital, a week or so at my house to make sure that you're healing okay. A couple weeks recuperating at home, you'll be as good as new.
That's a long time, especially in the summer, during fishing.
I understand, but think of this surgery as a way to help you enjoy fishing and berry picking for many years to come. Talk to Rita and your other family members. Talk to your friends. We'll call you to schedule the surgery. We don't want the cancer to have time to spread to other parts of your body. What questions do you have? Well, if you think of anything, write it down so you can remember to ask.
I will.
Now, because you have colon cancer, your relatives are at higher risk. I'd like you to talk to Jake, our patient navigator, about that. Rita, you know where Jake's office is.
Sure.
Good. So we'll be calling you, okay?
Thank you, doctor.
You're very welcome.
Hi, I'm Jake. I'm the patient navigator.
I'm Hazel.
Please come have a seat. What could I do to help you?
I just been diagnosed with colon cancer. Dr. Newman said something about contacting my relatives.
It would be helpful if you let your family members know about your diagnosis. Colon cancer could sometimes run in families, so I'd like to get a list of your first-degree relatives.
This means your brothers and sisters, your mom and dad, your kids.
With your permission, I'll contact them and encourage them to come in for earlier and more frequent colon screenings.
Auntie, I'd rather know that I'm at risk than have something sneak up on me. The rest of the family would want to know too.
I guess they do need to know.
Here, I'll help you.
How did I get colon cancer? We never had cancer in our family.
We don't know all the reasons people get cancer, but what we do know is Alaska Natives have a higher rate of colon cancer than the general population. That's why screening is so important.
And if I had my screening done when I was supposed to, Dr. Newman could have removed those polyps before they became cancer.
I'd like you to consider talking to a friend of mine. Her name is Dinah. She had colon cancer surgery a few years ago.
I know her. She's a really neat lady. You'll like her.
Is it okay if I tell her you might stop by?
Yeah, that'll be okay.
Shall we go see Dinah? How about doing it for your favorite niece? I'm gonna go get groceries, run some errands, and I'll be back in an hour.
And inhale, arms up. And exhale. Great job, everyone.
I'm looking for Dinah.
I'm Dinah.
Hi, I'm Hazel, Rita's aunt.
Oh, yes. Jake said you would be stopping by. How is Rita?
She's been a big support. She went with me to see Dr. Newman.
Oh, I know how important that is.
Hi, Mom.
Sure. The next flight. Love you. We need to go to Anchorage.
You know, it's been 7 years since I've been cancer-free. I'm in the best shape of my life. I walk every day, I dance, I sleep like a baby. I even quit smoking. You know, they say smoking can cause polyps. Maybe that's why I ended up with colon cancer. So I quit. It took a while, but I quit.
Good for you.
What I crave nowadays is good, healthy food. Blueberries, salmon. I'm going to the village next month. Gonna be fishing, pulling in huge nets full of fish. I'm having fun.
Dr. Newman wants to take out a part of my colon.
And you know what? You'll be just fine without it.
Hazel needs surgery, and I want to be there. She's my only sister. I want you to promise me one thing.
If I can.
I want you to promise me neither one of us is going to give her any grief over the fact that she didn't get her colon screening when she should have. The past is the past. All we're going to do is give her the love and support she needs.
If Rita and my sister and her husband said it once, they said it 100 times. Get your colon exam. Just do it. Don't wait. But I'm stubborn. Won't listen. Too busy. I just would never find the time to do it.
Yeah, I know. I was even more stubborn than you were.
How'd you manage to do that?
Well, most people, men and women, should get their first exam when they turn 50. But I have a family history of colon cancer. I need to get my first exam earlier, 10 years before the age my father was when he was diagnosed. But I would just never find the time to do it.
Oh, that's a lot of groceries.
Thought we'd eat at home for the next couple of days.
You're just like Isaac. Oh, my favorite, blueberry yogurt. Oh,
No. That is for after the surgery. You look a little tired. Why don't you go work on your beading? I
okay.
got this.
All right. Beading helps me relax. Beading reminds me of Mom in the old ways. You guys, you didn't have to go through all this trouble for me, and Isaac too. What are you doing here?
Well, we're worried about you. I'm due for my mammogram anyway.